Okay, guys, open your book. We're gonna do chapter 5 together. Ouvrez livre nous, nous allons faire chapitre 5 là ensemble. You ready? Okay, now on the state exam, they will not hesitate to ask you plenty of questions on mental health. Dans l'examen l'État, il y a un pile question. Bon, attention, s'il vous plaît. Il y a un pile question qui basée sur santé mentale et maladie mentale. Okay? So, mental illness and mental health. Chapitre parler de maladie mentale et santé mentale. Okay, so we're gonna cover confusion, dementia, and Alzheimer's. All three affect the mind. What nervous system is affected? Chapter 4. What system is affected? I just said nervous system. Very good. Okay, so your patient may be confused. Every day you walk in, if your patient knows your name, and then one day you show up, they don't know who you are, then there's confusion. Parce qu'on a qu'à confus. Si chaque jour le connaît et puis on l'autre jour paraît, il pas connaît, il peut peut-être faire confusion. What is confusion? Let's read together. Only ensemble. Come on, let's go. Confusion is the inability.
A confused person has trouble focusing, its attention, and they feel disoriented.
Very good. So let me help you. Confusion is the inability to think clearly and logically. A confused person has trouble focusing his attention and may feel disoriented. Confusion, c'est lorsque moun a perdu habilité pour le penser clair et logiquement, il perdu habilité pour le concentrer, pour le prêter attention et il sentit désorienté. Confusion interfere with the ability to make decisions. Il interfère avec habilité pour faire décision. The person's personality may change. Personnalité moun capable changer. He may not know his name, the date, other people, or where he is. Or a confused person may be angry, depressed, or irritable. So you can take a seat for me. Yon moun qui confuse, personnalité est capable de changer. Come back later. 2 o'clock. Personnalité est capable de changer. Li qui doit pas songer qui genre relé, qui date jeudi aillé, qui côté lié. Et ou ka paraître sur lui, elle très fâché, il fait dépression ou bien il est très mauvais. All right. So confusion can be caused by physical illness. Confusion capable causée par des maladies physiques. Page 115, example. Urinary tract infection, let's go. Low blood sugar can cause confusion. Head trauma, head injury, dehydration, nutritional problem, fever, drop in body temperature, lack of oxygen, medication, infection, brain tumor, disease or illness, loss of sleep and seizure. Toute condition ça yo capable causer confusion. All these physical illness can cause confusion. Okay? Infection urinaire, sucre trop bas, frappé dans la tête, déshydraté, problème nutrition, la fièvre, température corps descend, manque oxygène, médicaments, infection, tumeur dans brain, perte de sommeil, maladie, crise cérébrale. Now, guideline. What do we do for a patient who is confused? Qui ça pour nous faire pour un patient qui est confused? Not now, sweetie. I'm doing a video. I'll be with you. Do not leave the confused resident alone. Stay calm. Provide quiet environment. Speak in a lower tone of voice. Speak clearly and slowly. Introduce yourself each time you see the resident. Remind the resident of location, name, date, and the calendar may help. Explain what you are going to do using simple instruction. Be patient. Do not rush the resident. Talk to the resident about plans for the day.
Keep them routine and help.
Encourage the use of eyeglasses.
Hearing aids. Make sure they're clean and not
Okay,
damaged.
very good. Let's stop right there. So, a patient who is confused, you gotta pay attention to some of these things. Do not leave the confused resident alone. Pas quitter le pour compte. Stay calm. Give them a quiet environment. Your environment qui quiet. Okay? Speak in a lower tone of voice. Parlez plus bas. Lower your voice. Introduce yourself. Introduis-toi tout. Remind the patient. Rappelez patient de tout ça oublié. Okay? Be patient. Take your time. Prends sang pour bailler patient sa soin. Okay? Delirium is a more severe confusion that occurs suddenly. It's a more severe. C'est une confusion qui est plus profond. Okay? Now, page 116. Symptoms of delirium. Delirium, non, il y a des symptômes. Delirium, non, c'est une confusion qui est plus profond, right? So, symptoms of delirium: agitation, anger, depression, irritability, disorientation, trouble focusing.
Problem with speech, changes in spending or perception, changes in consciousness, decrease in short-term memory.
Very good. So, information about the guideline on confusion is also important and you can use that for your patient that has delirium. Information gen nan guideline nan pour patient qui confuse là, ou capable d'utiliser pour patient qui fait delirium. Pas oublier, c'est une confusion qui est plus profond. It lasts longer. So the delirium is a confusion that lasts a little bit longer and is more severe. So anytime you see those symptoms, tell the nurse. N'importe là où est symptômes ça yo qui sont faits, tell the nurse. You tell the nurse. All right. So when communicating with the person with delirium or confusion, same guideline. Keep your voice low. Don't shout. Use the person name. Speak clearly. Simple sentences. Be aware of your facial expression and body language. All right. Be gentle and try to decrease fears. Lo ap communiquer avec patient sa yo, baissez voix, ou pas besoin relé. Utilisez non moun nan. Fais so ap di a très simple. Et puis, prêtez attention à expression corps et expression visage. Your facial expression is something that the patient will imitate, and they will give you back what you give them. If you give them a smile, I'm going to give you a smile and you will smile. Watch. See that? Even people that don't want to smile, they see my smile and they like it. It's not the most beautiful smile in the world, but you see me smile, you're like, oh, he's friendly, right? Although I know I'm cute, be quiet. All right? But if you show up to the patient and you look like this, what do you want? Believe me, the patient will give it right back to you. Sou paret a min sou visaj ou, c'est ça passe en premier. Ou paret a un sourire sou visaj ou, c'est ça la premier. Okay? Now, page 116, when the mind is in good health, le bren nan en santé, le mind nan en santé, nou rele sa cognition. We call it cognition when the mind is in good health. You have the ability to think clearly and logically. Ou capable penser clairement et logiquement. Okay? So when we say cognitive impairment, Là, nous parler de cognitive impairment, we are talking about mental illness. Nous parlé de maladie mentale. Impairment is when there's a loss of ability to perform certain functional tasks. Là, nous parler de impairment. Impairment, là, c'est une perte d'habilité pour performer une fonction ou bien une activité. All right? Example of cognitive impairment is dementia. What is dementia? Let's read dementia together. Ensemble. That is a general term that refers to a serious loss of such as thinking, remembering, reasoning, and communicating. As dementia advances, these losses make it hard to perform activities of daily living, such as eating, bathing, dressing, and eliminating. Dementia is not a normal part of aging. All right. So, avec dementia, ou perdu habilité pour songer, pour penser clair, pour raisonner, pour communiquer. OK? Ou même bien perdu habilité pour prendre soin tête pour performer activité of daily living. Ou bien perdu habilité ça, et dementia n'est pas normal. Right? Now, the most common form of dementia is Alzheimer's dementia. Okay? Dementia qui plus commun, li relé Alzheimer's dementia. Okay? Now, Alzheimer's dementia, let's read a little bit about it. Alzheimer's, page 117. Alzheimer's disease causes tangled nerve fibers and protein deposit into form in the brain. They eventually cause dementia. There is no known cause of AD, which is Alzheimer's dementia, and there is no cure. Diagnosis is difficult, involving many physical and mental tests to rule out these other causes. Okay? So the only way they can tell someone has Alzheimer's is after they dead, they die, they do a test, they do autopsy. Meilleure façon de déterminer vraiment que c'est dementia, et le moun nan fin mouri, yo fon tête la en deux, yo rale brain nan et puis al étudier. So they go study the brain after the person dies to determine that was dementia. Okay? So, dementia, Alzheimer's dementia is progressive. C'est une maladie qui constamment progresse. The more the dementia progresses, the patient loses more ability. Plus maladie a progressé, c'est plus patient pour perdre plus habilité. Okay? Now, people with dementia may show symptoms in their behavior. Moun qui fait dementia, Alzheimer's dementia, yo va gen des symptômes qui paraissent dans aptitude yo, dans action yo, dans comportement yo. Okay? So, symptoms of AD appears gradually. It begins with memory loss. I will take questions after. I'm recording this. Let me take questions after. Okay? Symptoms of Alzheimer's appears gradually. Symptômes yo paraît graduellement. Okay? It begins with memory loss. Il commence avec perte de mémoire. Okay? And then it causes greater and greater loss of health and ability as the disease progresses. Pendant que maladie a progressé, gon série de maladies physiques tout qui commence à entrer sous moun. Okay? So physical illness begin to creep in. Okay? People with AD may may get disoriented, confused about time and place, you're désorienté, you're dans confusion concernant temps et place. Communication problems are common. They have problem with communication. You've get problem communication. They lose ability to read. You've been back read, write, speak, understand. They lose all of that. You perdu abilité pour lire, tendre, comprendre, etc. Pour même parler. Mood and behavior changes. Allure yo changé. Aggressiveness. You can do having pi agressif. Wandering. Marcher, monter, descendre, saute dans chambre, aller dans chambre. They're walking back and forth for no reason. Withdrawal from all part of, and withdrawal are all part of AD. Withdrawal, patient montré en dépression comme s'il pas participé dans rien. Withdrawal they don't participate in activities. Okay? So the patient may have difficult behavior. Okay? Patient capable de montrer des attitudes qui difficiles. Remember with chapter 2, we talked about, was it chapter 2 or chapter 3? Combativeness. Patient vin pou l'gou violent behavior. Angry behavior. Remember we talked about that, right? Nous te parlé comment you have been violent, fâché, even with inappropriate sexual or social behavior. You vin gen des aptitudes qui pas appropriées à la société. A patient with dementia, un patient qui fait Alzheimer's dementia, they could sit right next to you and decide to fart and let it go. Li ka jishita bokoto la, et puis on pete kembe, li di ma plache sa. That's a behavior that is not socially appropriate. C'est pas une aptitude, une action qui est appropriée socialement. Right? So if a classmate next to you does that, just remember chapter 5, sitting next to you. So gon élève qui chita bokoto qui lâche un pété, tout connaît ça son chapitre 5 qui a fonctionné là. All right? Parce que ça n'est pas approprié socialement. Okay? All right. Now, so patient with dementia may even have excuses. Moun nou ek fait dementia, lèl fè sa pa approprié, al go excuse pour ça. Okay? Pété a kembe m'la gel. So, they just let it go. No reason, no logic. Okay? Page 117. These attitudes help nursing assistant give the best possible care to residents with AD. Mais qui attitude que un nursing assistant doit gagner lorsqu'on prend soin patient qui fait dementia? Number 1, do not take things personally. Pas prendre personnel, c'est pas exprès le faire. Be empathetic. Put yourself in their shoes. Mettez tête dans place. Work with the symptoms of behavior you see. Travaille avec behavior where. Work as a team, page 117. Il a nou issue. Page 117, work as a team. Be aware of difficulties associated with caregiving. Reconnaître que li pas facile pour prendre soin moun qui malade nan tête. It's not easy to take care of people with mental illness. Work with family members. Remember the goal of the care plan. Travail de commun accord avec famille patient. Okay, now, communication with, how do we communicate? How do we take care of someone with Alzheimer's dementia? Number 1, approach from the front. Okay? Pa approcher le pas derrière ou faire qu'elle saute. Approcher le pas devant pour pas mettre mes sous, pour pas faire mal. Approach from the front. Smile and look happy. Mets ton sourire sur visage. Determine how close the person wants you to be. Déterminer à quelle distance patient t'as mon campé devant nous. Communicate in a calm area with little background noise. Pas de gen bruit dans zone côté ou parler ensemble avec lui pour pas bouiller l'esprit. Identify yourself and use the resident's name. Speak slowly. Use lower tone of voice. Don't expliquer ça déjà, right? Baissez voix. Repeat yourself. Use the same words. Use signs, pictures, gestures, or written communication to words to help communicate. Utilisez signes, photos, gestes, mais faites ça de manière calme, de manière souple. Okay? Break complex tasks into smaller, simpler ones. Give simple instruction. Instruction à bay patient doit être simple. OK? Si on bagay compliqué, essayez d'expliquer l'île de manière claire. Something is complicated, explain it to them in a very clear way. Talk to them as if, give explanation as if you're talking to an 8-year-old child. That needs clear explanation. Parler avec un autre coup sous ta parler avec un petit monde qui besoin d'explication qui très clair. Now, if the resident is frightened or anxious, si patient li peur, okay, speak slowly in a low voice. Calm your voice. Try to see or hear yourself as the resident might. Always describe what you are going to do. Use simple words or in short sentences. Check your body language. Si patient peur, faut-il baisser voix, OK? Utilisez des mots qui simples. Gardez pour qui image, qui message, posture à démontrer par patient. Okay? If your body language looks upsetting, the patient will be very afraid and upset. Page 118. If the resident forgets and show memory loss, okay, repeat yourself using the same words. Répétez tête ou redis sortez dire encore et en utilisant les mêmes mots. All right? Patient may use what we call perseveration. Patient capable d'utiliser ça nous relève persévération. That means they repeat the same words over and over again. Ils répètent les mêmes mots constamment. For example, patient may say, I want to go home. 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 Non-stop. You must understand that this is a symptom. Control your temper. Contrôlez tempérament. Contrôlez tête ou pas besoin mauvais sous moun. C'est symptôme maladie à ça. If resident has trouble finding names, suggest a word that might sound correct. Okay? Si patient a difficulté pour joindre mot table dia, suggérez un mot pensez qui est capable correct approprié à ça mon vle dire. If the resident seem not to understand basic instruction, patient qui fait dementia qui doit avoir une perdue capacité pour comprendre instruction qui est très simple. Ask the resident to repeat your words. Demandez au résident pour répéter ce que dit là. Note the communication methods that are effective and use them. Cherchez méthode de communication qui est effective et utilisez-le. Watch for non-verbal cues as the ability to talk lessens. Observe body language, eyes, hand, and face. Veillez action moun nan a posé ou bien langage de corps li pendant ou a parler ensemble avec lui parce que moyen de communication kan vin diminuer. Okay? Use pictures, gestures, or written words. For example, a picture of a toilet on a bathroom can help remind a resident where the bathroom is. Ou ka utilize signes, photos, gestes. Tant que par exemple, si vous faites photo toilette là pour mettre sous pot toilette là, la pour rappeler patient que c'est la toilette là. If the resident wants to say something but cannot, si patient a vle di yon bagay men pa ka jwen mot, ask the resident to point, mande pou longe douet li. Gesture, fait de geste, or act it out. Mande patient pou agir, pou faire un geste pour montrer, ça vle di. If the resident is upset or cannot explain, offer comfort with a smile and try not to distract to distract the resident. Verbal communication may be frustrating. Si vous avez un patient li upset parce que le pas ka jwen mot pour le dire. OK? Offrir confort. Et puis, anti-sourire. All right? It's very upsetting when you're trying to try to say something, but you don't know the words. Li vraiment dégoûtant, ou ap essayer di yon bagay ou pa jwenn mot yo. Et donc, ou ap essayer parler anglais. Ton nez. Ou ta fout bat yon moun. Like when you're trying to speak English, but you can't find the words. Teacher, I need to go kaka. Okay? Me go kaka now. Okay? Bye. So, joindre ça pour dire alors pas gen vocabulaire là, li vraiment dégoûtant. Finding what to say when you don't have the vocabulary is pretty upsetting. If the resident does not remember how to perform basic tasks, parce qu'il a oublié, pas connaît comment pour prendre soin tête li encore. Okay? Break activity into simple steps. Okay? Bal des directions qui très simple. Let's go for a walk. Stand up. Put on your sneakers. First the right arm, then the left arm, etc. So, pendant montrer des patients habillés ou bal direction très courte de qui ça pour le faire. While helping the resident to dress, you give him short directions on what you want him or her to do. Okay? If the residents insist on doing something that is not safe or not allowed, si patient insiste pour faire un bagay qui pas safe, okay? Redirect activity towards something else. Try to limit the times you say don't. Rediriger activité a, mener la fon l'autre bagay pour distraire. Comprendre? Par exemple, patient vle al la kali, et pour dire, ben ok, on a l'en chambre, on a préparé. Ou distraire, distance dérivé dans chambre, on oublié. Example, patient says, I want to go home. That's not allowed. So what do? You say to the patient, okay, let's go get you ready in your room. By the time they get in the room, they forget that stuff. Okay? If the resident hallucinates, see or hear things that are not really happening, or is paranoid, try not to take it personally. Try to redirect behavior or ignore it. Si patient commence à faire hallucination, ça veut dire la pouè bagay étant des bagay qui pas réel, pas prendre ça comme si son attaque personnelle contre lui. Et puis, cherchons moyen distraire pour faire un autre bagay. If the resident is depressed or lonely, take time one-on-one to ask how he feels. Si patient paraît que le fait dépression, il paraît triste, pour un petit temps, demander comment il sentit, faut il parler avec lui. Try to involve the resident in activity. Essayez d'inclure dans l'activité qu'a fait yo. Okay? Report sign of depression to the nurse. Al fait nurse ça connaît qui j'en ouais patient. Ask the resident to tell you what, if the resident repeatedly asks to go home, ask the resident to tell you about the house, about their home. Patient mando pour la Kylie, mande pour faire un petit parler de Kylie. Right? Redirect or guide conversation towards something else. Rediriger conversation vers un autre bagaille. Okay? If the resident is verbally abusive, remember, it is the dementia speaking, not the person. Si patient verbalement abusif, songez que c'est ces maladies à cap parler, c'est pas mon nom. Okay? Resident lost his verbal skill. Use nonverbal skills. Use nonverbal communication with them. Okay? Smile, touch, laughter. All right? Approach slowly. Touch slowly. Be gentle. Si patient vient perdre l'habilité pour communiquer, pour parler, eh bien, qu'on y a, on va servir avec non-verbal communication, on va un petit sourire, toucher doucement, baisser voix, approcher lentement, doucement et avec beaucoup plus de souplesse. Page 120. Patient with dementia, with Alzheimer's dementia, will have a problem with ADL care. Patient qui fait dementia, il va pour développer problème pour performer ADL care. Okay? So, how do you care for these residents? Nursing assistants should use the same procedure for personal care and ADL for all residents with Alzheimer's disease. Nursing assistant doit utiliser même procédure là pendant que la baille soin à tout résident qui fait Alzheimer's. Okay? Now, they should use the same procedure as they use for other residents. Même gens prend soin l'autre patient yo, c'est même gens prend soin patient qui fait Alzheimer's là. So the same way you care for other patients, you do the same for these Alzheimer's residents. Develop a routine and stick to it. Développer une routine, comment on fait ça, et rester dans la routine, non pas jamais changer. Perform self-care. Helping residents care for themselves as much as possible. Aider patients pour participer dans soins tête li. Number 3, take good care of themselves, both mentally and physically. Faut que nursing assistant tout la prend soin tête li, physiquement et mentalement. Taking care of mental health residents is not easy. It gets frustrating. Okay? Prends soin patient qui malade mental pas facile. Li marcher avec un pile frustration. So you must take care of yourself mentally. Faut prendre soin tête ou mentalement. That means sometimes you have to take a day off. Take a break. Okay? Maybe if you can't work with this patient, ask him to give you another one. Okay? So, we assist the resident with ADL. Guidelines. Okay? Guidelines with ADL. Assisting with ADL. Number 1, with bathing. Schedule bath when the patient is least agitated. Okay? Be organized so that the bath can be quick. Ben patient, les patients moins agités et fait bien ou fait pour patient faire rapide. Prepare the resident before bathing. Préparer patient. Tell the patient what you're going to do. Dis patient ça pour le faire avec lui. Take a walk with the resident down the wall. Marcher ensemble avec lui pour connaître pas pour compte. Make sure the bathroom is well lit and has a comfortable temperature. Make sure que lumière bien lumière dans la toilette là et température là normale. Give privacy. Be quiet, be calm and quiet when bathing the resident. Okay? Be sensitive when talking to resident about bathing. Montrez un peu de compréhension. Montrez un peu de sensitivity. Okay? Give the resident the washcloth to hold. Bal kembe washcloth là pour capable nettoyer colis. Okay? Next one. If the resident has problem with grooming and dressing, help with grooming to help the resident feel more comfortable with their appearance. Aider avec grooming. Avoid delay. Éviter pour pas get interruption en soin balia. Give privacy for privacy. 4. Show residents some of her clothes. Montrer le rad li pral met sou li. 5. Encourage the resident to pick clothes to wear. Encourager patient pour li choisir rad li pral mette. Okay? Lay out clothes in the order in which they are put on. They are to be put on. Arranger radio dans ordre que patient a dû mettre. Okay? For example, you see the underwear, the t-shirt, socks, pants, and pullover shirt. Tout bagay en ordre. Okay? Break tasks into simple steps. If the resident has problem with elimination, si patient a un problème avec élimination, encourage fluid. Encourager patient pour boire plus d'eau. Never withhold or discourage fluid. Pas jamais empêcher le boire ou bien décourager le pour le boire. Just like that. Mark the bathroom with a sign. Mettez un signe dans porte toilette là pour lui. Make sure there's enough light in the bathroom. Lumière lumière pour lui. Note the resident when the resident is incontinent. Is incontinent for 2 to 3 days. Check her every 30 minutes. Si patient est incontinent pour 2 ou 3 jours, check-le chaque 30 minutes. Observe toileting pattern for 2 to 3 nights to determine nighttime bathroom time. Okay? You can wait inside. All right? Observez comment patient utilise toilette là pour voir comment chaque killer aller à la selle. Take the resident to the bathroom after drinking fluid. Menez pas passer dans la toilette après le fin boire. Okay? If resident has problem with nutrition, si patient a problème avec nutrition, avec manger, encourage nutritious food. Encouragez le manger qui est bon pour lui. Okay? Have meals at a regular time. Menez manger dans l'heure qui régulier. Pas changer routine. Do not change the routine. They hate that. Okay? Make sure there's proper lighting for gain lumière de côté où le manger. Keep noise low and reduce distraction. Baisser bruit et réduire, éliminer distraction. Otherwise, they don't eat. Okay? Keep tasks simple. Kembe travail à faire très simple. Sometimes we have to give them directions and tell them what to do. Okay? Des fois, c'est nous qui disons comment pour manger. Mr. John, pick up the spoon. Put some carrots on it. Put it in your mouth. Chew, swallow. Des fois, si c'est pas ou dit, brin nan pas dit, li pas fait. Okay? Now, page 122, page 122. Use a simple place setting with single eating utensil. Remove other items from the table. Okay? Utilisez place qui simple pour passer en cas manger. Put only one item of food on a plate at a time. Mettons seulement partie de manger à notre plat là devant patient à la fois. Give simple, clear instructions. Bayo instruction qui simple et claire. Guide the resident through the meal. Guide pendant la manger. Provide simple instruction. Offer regular drinks of water, juice. Use assistive device. Okay. Use assistive device for eating. Special spoons and bowl as needed. Make mealtime simple and relaxed. Okay. L'heure pour patient manger, fait que son heure qui très simple, fait processus là très simple pour patient. Make the procedure very simple. Promote residents' physical health. Encourager patient pour le maintenir santé physiquement. Prevent infection and follow standard precautions. Ça, vous comprenez, pas vrai? Observe residents' physical health. Okay? And report any problem. Observer corps patient, observer santé physique et rapporter n'importe problème by nurse là. Help residents wash their hands frequently. Aider pour laver mains très souvent. Watch for sign of pain. Reporter signes de douleur by nurse là. To promote resident mental and emotional health. Maintain self-esteem by encouraging independence. Encourager patient pour l'indépendance que l'a fait, dans soins que l'a recevoir, OK? Pour bailler tête les soins tout, ça va permettre que self-esteem a monter plus haut, OK? All right, now let's talk about difficult behavior. Nous allons parler de attitude, de action qui difficile. Okay, difficult behavior. Difficult behavior are some of the reasons why these patients are some of the risk factor of being abused. Les patients ont des aptitudes qui sont difficiles, ça cause que ça est devenu un facteur, un risque facteur pour les gens qui ont soin abusés. You, nursing assistant, if you understand that what you're seeing is symptom of the disease, you will not abuse the patient. Ou même nursing assistant, si vous comprenez que ça a regardé, c'est symptômes maladie, ou pas abuser patient. Number 1, agitation. Resident who is excited, restless, or troubled is said to be agitated. Qui ça pour faire pour un patient qui est agité? What can you do for a person who is agitated? Number 1, page 123. Try to remove trigger. Trigger is what's causing the agitation, the situation. Situation qui cause agitation. Trigger can be they're hungry. Li ka grand goût, c'est ça qui trigger, qui fait l'agiter. Maybe the patient is in pain. That's the trigger. S'il gen douleur, c'est ça qui cause li agiter. S'il chaud, besoin baigner. If the patient is hot and they want a bath, that can cause agitation. It's just like a baby. C'est un petit bébé. If baby is hungry, what do? Si bébé a grand goût, qui ça le fait? They crier. Baby tired, what they do? Cry, upset, sleepy, cry, pain, cry. Tout ça bébé a besoin, c'est crier pour lui. So, patient with mental disorder, with mental health problems, they show actions and behavior. Remove trigger, keep a routine, and avoid frustration. Reduce noise and distraction. So remove trigger means let's take care of the problem. Vous comprenez? Remove trigger veut dire on nous prend soin problème qui cause patient agité. Sundowning. When a patient with AD gets restless and agitated in the late afternoon, evening, or night, it is called sundowning. Please, please, please underline, souligner, sundowning. That is state exam material. Sundowning. Souligner ça ba mwen. Blan di souligner yo do. Sundowning. Wap bezwen konen ki sa liye. Sundowning. Agitation. You need to know what that is. Sundowning is patient becoming restless and agitated in the late afternoon. What do we do? Ki sa pou nou fè pou pasyen sa? Daily exercise routine. Encourage the patient to dress in regular clothes during the day. Provide adequate lighting before it gets dark. Avoid stressful situation during this time. Soft music. Set bedtime routine and keeping it. Souligner ça ba mwen, s'il vous plaît. Underline. Set bedtime routine and keeping it. Souligner ça. Set bedtime routine and keeping it. Okay? Remove caffeine from the diet. Retire caffeine dans la diet là. Okay? Catastrophic reaction. Catastrophic reaction. Page 123. When the residents, underline that please. When the resident with AD overreacts to something. Li gon reaksyon ki exagere concernant un bagay ki rive. They overreact. What can cause catastrophic reaction? Fatigue. Change of routine. So, l'on fin établi une routine rete la dan. When you establish a routine with these patients, stay there. Overstimulation, too much noise. Difficult choices or tasks. You cannot take an Alzheimer's patient in front of a closet and ask him to choose. Ou pa ka pran un patient qui fait Alzheimer pour mener devant un closet qui charge à grade pour demander pour choisir. That's too many clothes. That's too much. Give them 2 clothes. Buy your 2 rad seulement. Between this one and that one, which one do you want? Okay? Make it simple. Violent behavior. Action violent. Like I said, I'm doing a video. Write down your questions, honey. Okay? I'll take it after the video. Open? Okay. All right. Violent behavior. A resident who attacks, hits, or threatens someone is using violence. Okay? Action violent. Patient ka leve men sou ou, attaquer ou, menacer pour le bon coup. Okay? Frustration, overstimulation, or change of routine environment, all of that can trigger violent behavior. Okay? Fin suivre lecture là, après ça, va poser une question. Après ça, on a fait ti parler. Déjà fait compétition à bébé là. Okay. So, understand the violent behavior is part of the disease symptom. Okay? So think about your safety as you approach the patient. Pensez à safety power. Lo approcher patient ça. Okay? How can you deal with that? Comment qu'on fait deal avec violent behavior? Call for help if needed. Block blows, never hit back. Souligner ça pour moi, s'il vous plaît. Underline that. Block blows, bloquer coup de poing, mais pas remettre. All right? So, the way to avoid getting hit, soon as the patient seems frustrated, back away, let it go. Pour éviter behavior qui violent yo, Suivez-moi, oui. Automatiquement, ou est patient, il est frustré, quittez ça. So, persister, la grave. So, let it go. Do not persist. Try not to restrain the resident. And try to remove trigger. OK? Really demander aide, pas remettre coup, bloquer coup, pas kembe patient. Courir sorti quitter pas chambre non. Next, pacing and wandering. A resident who walks back and forth in the same area is pacing. Un résident qui marché, monter descendre dans le même côté, we call that pacing. Il est en place et puis il a marché. We call that pacing. A resident who walks aimlessly around the facility is wandering. Yon passeur qui a marché entrer dans plusieurs chambres, il n'est pas vraiment gon destination, nous relève ça wandering. Okay? What can cause pacing and wandering? Qui ça ka cause ça? Restlessness, a hunger, grand goût ka fait ça. Disorientation can cause that. Passeur vin plus confus. Incontinence. Li popo sou li besoin nettoyer, mais pas ka di ça. The patient is dirty, they poop on themselves or pee, they need to be clean, but they don't have the verbal skills to say it. So that makes them pace and wonder. Constipation, pain, etc. Forgetting how and where to sit. Imaginons que patient oublié comment pour le chita et qui côté pour le chita. Patient forget where and how to sit. There's an English saying that says, a mind is a terrible thing to waste. Your brain, capacité mentale, c'est un bagage qui terrible sur bedil. Parce que depuis tête la malade, tout reste là son bout de viande qui pas utile en merde. Once the head is sick, the rest of it is just meat and bone and useless. So, page 124, if the resident wonders and pace and wonders, remove cause when possible. Okay? What's causing them to pace and wonder? Take care of that problem. Let the resident pace and wonder in a safe, secured, locked area. Quittez patient appelé des marchés, monter descendre dans une zone qui safe. Ou pas qu'à stopper. Redirect attention to something the resident enjoy. We dirige attention yo à bagay que patient enjoy. Que li capable sentir bien la donne. Okay? 124. Hallucination, delusion. Hallucination, patient sees or hear things that's not there. Patient wè bagay ki pa réel, li tande de son, li tande parole ki pa réel, li wè moun ki pa réel. Patient see things that's not real. Delusion. Patient is believing things that's not real. Patient vin kwen nan des choses ki pa réel. How can we control that? What can we do for these patients? Ignore how harmless hallucination and delusion. Si hallucination ou bien delusion nan, li pa cause dégâts physiques, fè comme si li pa an impact bad. Example, patient says, I see the Pope coming. Li wè le papa vini. Okay. I mean, if you see the Pope in the room, that's fine. Pasen dou li wè papa la chita nan cham nan, ap tan pou vin pala avè. It's okay. You don't have to correct that. Ou pas besoin corriger ça. Okay? Reassure resident who seems agitated or worried. Do not argue with the resident who is imagining things. Pas discuter avec patient qui a imaginé des choses. Ou bien qui ouais des bagailles qui pas réelles. Et si patient paraît agité, aidez pour le calmer. Depression. People who become withdrawn, lack energy and stop eating or doing things they used to enjoy may be depressed. Depression may cause the following symptoms. All right. So, yon lot maladie mentale, c'est dépression. Another mental illness is depression. Withdrawn, ça veut dire pas intéressé dans rien encore. Lack of energy, il vient perdre toute énergie. Li pas même manger encore. Ça te qu'on enjoy, li pas enjoy encore. Nous dit moun ça li fait dépression. So people with Alzheimer's can also show signs of depression. You can develop dépression. High depression, pour qui ça depressed, et parce que you're constamment confused, you senti you perdu. Patients feel constantly confused and they feel lost. So, patient will have loss of independence, inability to cope, li perd indépendance li, c'est ou pou fè tout pou li, inability to cope, li pa ka di la problème encore, feeling of failure or fear, li senti, li pe, li senti, li fè défaite. Reality of facing a progressive and incurable illness. Li gon réalité devant que le connaît. Et réalité c'est que li gon maladie mentale que le pas gen contrôle. So the patient is living the reality of knowing that they have a mental problem and they have zero control. You would be depressed too. So t'as nan place li, dépression t'a fin avant. Okay? Disruptiveness. Well, let's go to the next page. Page 125. One more page and we're done. If patient is depressed, report sign of depression. Rapportez signe dépression by nurse là. Let the nurse know this patient is very sad, non-stop. Fais nurse là connaît que patient très triste. Observe for triggers. Gardez pour qui ça qui cause tristesse là. Si possible, vous pouvez changer ça. Just in case you can help them cheer up. Encourage independence. Encourager patient pour devenir indépendant. Listen to the resident if she wants to share her feelings or talk about her mood. Tendez patient. Prêtez patient aux oreilles si ta wel vle parler de comment le sentit. Perseveration or repetitive phrasing. Ça, c'est patient qui a plaidé répéter les mêmes mots, les mêmes paroles. That's the person that's repeating the same words, the same phrase, asking the same question. The nursing assistant should be patient and not try to silence or stop the resident. Faut prendre patience. Pas essayer stop li, pas essayer faire silence. Li pas bon pour, il pas bon pour patient. The nursing assistant should answer questions each time they are asked and use the same words each time. Toutes les fois patient pose une question, il pose la même question, répond la même question en utilisant les mêmes mots. Disruptiveness. Now, disruptive behavior is anything that disturbs others. Disruptiveness, là, c'est des actions qui disturbent l'autre monde. That's how I know I have a lot of students with mental illness. Et quand ça me connaît, me conseille de élèves là qui est malade mental. Very disruptive. Élève qui malade mental là, c'est chita bon koto, faut le déranger pour le faire parler. Il va quitter prêter attention. The student that's mentally ill must disturb you and take your attention away from your education. Quelqu'un m'a regardé là, m'a plongé doit être sous monde qui malade mental, mais mon cher. I know some of my students, they need help. Je connais quelqu'un qui lève là, franchement. Aïe, aïe, aïe. You got to be here. All right. So disruptiveness, if your patient is making noise, slamming doors, right? Being disruptive, like déranger les choses, yelling, banging furniture. Number one, be calm and try to find out why this behavior is happening. Restez calme et demandez patient pour qui raison behavior ça, action ça a fait comme ça. Find out why, cherchez connaître tout. Gently redirect the resident to a private area. Maintenant dans zone qui privée pour le capable calmer. Notice and praise improvement if the behavior improves. OK? Complimenter patient souhait attitude ap améliorer. Inappropriate social behavior include cussing, name calling, yelling, such as violent or disruptive behavior. Des aptitudes qui pas appropriées socialement. The nursing assistant should not take it personally. Pas prendre ça comme si son attaque personnelle. Don't take it personally. Okay? Try to find out what's causing the behavior. Cherchez connaître qui ça cap causer behavior, qui ça cap causer inappropriate social behavior. Redirect the resident to a private area. Menez patient dans zone privée pour le cas calmer. Inappropriate sexual behavior. Aptitude sexuelle, action sexuelle qui pas appropriée. Okay? Such as removing clothes, touching one's genital area in public, trying to touch others. Okay? Can disturb or embarrass those who see this. Action sexuelle qui pas appropriée dans la société. Yo. Patient qui doit arrêter la retirer sous lui, la main partie privée et puis la dit des mots et fait des actions qui pourraient embarrasser l'autre monde. The nursing assistant should not overreact. Quiet, please. Quiet. Let me finish with this. Nursing assistant, pas doué overreact, ça veut dire ou pas besoin d'une réaction qui est exagérée par ça ouais. Because you need to know and remember, this is a patient with mental illness. C'est ça que fait avant de commencer le chiffre de travail là, mandez nurse là pour le rapport de patient pour qu'on connaisse qui genre de maladie moun nan souffri. Before you start the shift, you need to ask the nurse for a report so you know what kind of physical and or mental illness that this patient has. So the nursing assistant should not overreact, pas overreagir. Try to determine the cause. May help. Chercher connaître ça cap cause de ça. Fait ça, capable aider. Gently redirect the resident to a private area. Et essayer ouais sous t'amener le bac dans chambre non point qui privé pour le cas calmer. Okay? Rummaging and hoarding. Hoarding is collecting and putting things away in a guarded way. Patient a marché, ramasser toute sa joine. Rummaging is going through drawers. Always looking for something. Hoarding, li marché ramasser. Rummaging, li constamment à chercher. Okay? All right. So, let's go a little bit quickly because we have to touch on chapter 6. Page 126, they should not be considered stealing. So elle a fait, pas maintenant tête ou c'est voler la volel. C'est symptôme qui comme ça. It's not stealing, it is hoarding. Okay? Label all personal item. Okay? Mettez un label sur toute bagaille qui privé qui appartenu à l'autre monde. Don't tell the patient's family that the patient is stealing. Ou pas besoin de dire famille que pas ça marche voler les affaires monde. Son maladie mentale qui fait que la ramasser tout ça joindre. It's a mental illness that makes them hoard and take everything they find. Okay? Sleep disturbance. Many times these patients have problem with sleeping. Okay? Make sure the resident gets moderate exercise during the day. So if they have to go to therapy, encourage that they go. Okay? Make sure patient, s'il gen pour la thérapie pendant la journée, pour le capable aller, comme ça la un peu fatigué dans la soirée pour le cas bien dormir. Allow the resident to spend time each day in natural sunlight. Encourager patient pendant la journée pour l'aller côté du soleil. Okay? And then at night, reduce the light. Le soir, réduire lumière là. Suspicious. Patient with AD often become suspicious as the disease progresses. Patient qui fait Alzheimer's, assez souvent, yo devenu paranoïde, yo suspect tout le monde. Okay? They accuse staff of stealing from them. Yo quand même accusé que vous te volé les affaires. Suspicion may escalate to paranoia, intense feeling of distrust, and believing others are out to get them. Suspicion est devenue paranoïa parce que vous n'avez pas passé en quoi que ou parti d'elle pour finir avec. Okay? The nursing assistant should not argue with the resident. Pas faire discussion avec patient. Pas besoin de chercher justifier tête tout. You don't need to try to justify yourself. Nursing assistants should offer reassurance, be understanding, and be supportive. Okay? Rassurer patient, montrer très compréhensif et très supportif. We use different kinds of therapy to help these residents. Validation therapy, this is when we let the resident believe what they want to believe. We don't correct them. OK? Toute terminologie, ça ou on a couvert dans le chapitre 5 là, familiariser tête ou avec you. Familiarize yourself with these terminologies that we are covering on chapter 5. Validation means to give value. All right? Meaning you don't need to try to correct them. Pas essayer de corriger patient. Le dit en parole qui pas dans normal li. Okay? Reminiscence therapy. This is when the patient wants to talk about the past, and we encourage that. Reminiscence therapy, c'est lorsque patient veut parler du passé, des anciens temps, et puis nous encourager li, et puis nous prêter les oreilles nous. Do me a favor. Underline, circle reminiscence. Soulier et circle reminiscence therapy. Paragraphe ça va besoin pour examiner l'état. Comme s'oublie. Reminiscence therapy, soulier, underline it, to study it. To reminisce means to talk about the past. Reminisce veut dire pour parler du passé. Okay? Activity therapy. This is therapy that uses activity that the resident enjoy to prevent boredom and frustration. All right? OK, so c'est là n'a campé. OK, avec chapitre 5 là. Nous prenons stop vidéo et qu'on y a là, nous prenons prendre question en main avant d'entrer dans chapitre 6 là. So we're going to stop with chapter 5 now and take your questions. All right. Thank you, my dear.